I'm Femi Oke, I'm your moderator. I'm also a journalist, so news is my business. I am going to take you back to 100-year-old headlines when researchers in Canada were making news. Work on diabetes shows progress against disease, says one headline. Toronto medical men hoping that cure is at hand. All caps, a boy is treated. You can kind of feel the excitement in that headline. Another one from the Toronto Daily Star. Toronto doctors on track of diabetes cure. So fast forward to 2021, and we know that either the lack of insulin or the body not producing enough insulin means that we can't use glucose in our bloodstream, and that really fuels us. That condition is diabetes. Right now across the world, more than 6% of people have diabetes, and the number is growing, which is why we are here. At the Global Diabetes Summit, the WHO will be launching the Global Diabetes Compact. It is a bold initiative. The idea is to support all countries to manage the prevention of diabetes and to support people with diabetes inclusively and comprehensively. There is so much to talk about. We start with the Director General of the WHO, Dr. Tedros Adhanom Ghebreyesus.
Excellencies, distinguished participants, dear colleagues and friends, COVID-19 has posed a twin threat to people with diabetes. Not only do they face an increased risk of severe disease and death from the virus, many diabetes patients have also experienced disruptions in care. Even before the pandemic, many people with diabetes did not have access to the life-saving care they need, often because of the cost. It's unacceptable that millions of people still cannot get insulin, which was discovered 100 years ago. We're going backwards when we should be going forwards. Type 2 diabetes is largely preventable, and all types of diabetes are treatable. And yet, the number of people with diabetes is going up, and deaths from diabetes are increasing globally, including for people under the age of 70. The diabetes burden is rising most rapidly in developing countries, which are the least well equipped with the diagnostics, medicines, and knowledge to provide life-saving treatment. For all of these reasons, we're today launching the Global Diabetes Compact. This initiative aims to reduce the burden of diabetes, improve outcomes, support prevention, and improve access to comprehensive, affordable, and quality care, including insulin. Through this ambitious and much-needed collaboration, we can prevent diabetes, save lives, and move one step closer to the healthier, safer, fairer world we all want. I thank you.
Thank you, Dr. Tedros. Co-hosting our Global Diabetes Summit, the Government of Canada, joining us now with an official welcome.
Bonjour, je m'appelle Patty Hajdu et je suis la ministre de Santé du Canada. And I am so thrilled to be here as a co-host of this important summit alongside Dr. Tedros and, of course, the WHO. Now, Canada is extremely proud of our contributions to saving lives of people who are living with diabetes. In fact, 100 years ago, insulin was first discovered at the University of Toronto. But we know that we have so much more to do to help prevent diabetes and, of course, protect the lives of people who live with diabetes. And that's why the Canadian Institute for Health Research continues to invest in ongoing research and innovation to break through barriers for people living with diabetes and to understand the role that the social determinants of health play in both acquiring the illness and living and managing it. Now, we know that investments in social determinants of health and helping to support healthier lives goes a long way in defeating diabetes in all of our communities. And that's why Canada's investments in things like affordable housing, access to fresh food, making sure that we reduce the cost of living, supporting healthier children through increases to Canada Child Benefits, these are all measures that we know have a direct and indirect impact on the incidence of diabetes. But we must do more. In fact, in our Parliament, a very important bill is being debated, and that is to provide a national framework so that we can all work together more closely to prevent diabetes and to support everyone living with diabetes across the country. Thank you, everyone who is attending this conference, who's working so hard on supporting people who live with diabetes around the world. Together, we will make a difference. We will reduce the cases of diabetes, and we will help people who are living with diabetes live longer, healthier, and safer lives.
Tanse Tatumskat Kakio. I would like each of you to take a moment to acknowledge the diverse traditional lands from which we are all gathered virtually today. My professional background is in nursing, and advancing the health and wellness of First Nations has long been a top priority of mine. I recognize the worrying trends in global diabetes data and ongoing needs regarding prevention, screening, and access to quality care. For the First Nations adult population, 50 and over, the rate of diabetes is around 3 times higher than the general population. However, diabetes onset is being observed at younger ages more frequently. There are many issues at play, and for First Nations, support for holistic healing practices is necessary. High rates of various chronic and acute illnesses stem from a number of deeper causes, what most of you would call the social determinants of health. In many First Nations cases, we must grapple with an overall lack of access to healthcare services where quality and safety are a luxury for many. This is just one of the many struggles that we face on a daily basis just to get our basic needs met. By working together and building truly fair and equitable partnerships and collaborations, we can improve outcomes for First Nations. We need meaningful investments in capacity that is sustainable and that can benefit from traditional knowledge and expertise. This must be essential within this process and cannot be an afterthought. Diabetes rates are cause for concern, and just as the causes are diverse, so too must our solutions be diverse, and they must be rooted in holism and culture. Hi, nanaskom nawag.
You are going to hear all the way through this summit enthusiastic support for the WHO's Global Diabetes Compact. Let's explore how ambitious it is. We're joined by Dr. Ren, Assistant Director General at the WHO.
Excellencies, I thank Canada for co-hosting this historical World Diabetes Summit today. We have the second opportunity in a century to change the course of diabetes. The current model of diabetes prevention and management has failed to provide equitable diabetes care to those who need it. Such inequities, which are our own creations, are immoral, and they are dangerous for our health, our economies, and our society. Hundreds of millions of people still struggle every day in poorest countries because they lack reliable and affordable access to diabetes medicines, glucose monitoring, and test strips. We can and we must change the status quo. Doing so is smart. Diabetes prevention, detection, treatment, and care is an investment for healthy lives and productivity, especially in the lower and lower middle income countries. But too few peoples are currently being reached. As immediate steps, lower and lower middle income countries must lead the way by embedding ambitious diabetes response in their COVID-19 recovery plans. The pandemic is a shocking reminder to protect people living with or at risk of diabetes and to build a high resilience future. Civil society and people living with diabetes must scale up their advocacy towards the governments to act on diabetes. The private sector must step up to provide immediate, concrete solutions to the governments to lower prices and improve the availability of insulin and other diabetes medicine and essential technology. The WHO Global Diabetes Compact provides a compelling opportunity for the world to turn 100-year-old ambitions into reality. The compact, which we are launching today, will support countries in developing and implementing new policies and programs to bring diabetes prevention, diagnosis, treatment, and care to all who need it. The key to success of the compact is to establish the coverage target for diabetes to support the country and regions-led efforts. To this end, I would like to highlight 6 imperatives. First, the compact is calling on everyone working in the field of diabetes to unite around inclusive and action-oriented narrative on diabetes prevention and treatment, with monitoring towards ambitious yet realistic targets. Second, the compact is bringing together all WHO tools and resources available for prevention and management of diabetes, both existing and new, into one seamless package. The third, to accelerate prevention, the compact will promote healthy living across the life course with a focus on reducing childhood obesity. Fourth, the compact will work towards improving access to diabetes medicines and technologies in the poorest countries and in humanitarian settings. Fifth, the compact will ensure the people living with diabetes have a seat at the decision-making table. You can count on WHO for seeking the knowledge and expertise of those with unique lived experience. WHO is strongly committed to working with people living with diabetes to ensure the support they need to charter a prosperous and sustainable future. 6. The compact aims to close knowledge gaps and stimulate innovations related to technology and leapfrogging for those hardest to reach, and quantifying the economy and human costs of failure to do so. Your support is crucial. I encourage all international partners to come forward with pledges to support WHO's Global Diabetes Compact. Let us work together to recover better and build a better world for all. Thank you.
This is how transformational change happens. You're about to hear from heads of government from around the world and the commitments they are going to be making to the Global Diabetes Compact. But first, I want to tell you about Singapore. In 2016, Singapore launched a war against diabetes. What does that even mean? Well, it was a strategy for the whole nation to have healthier lifestyles, to boost programs to help people manage diabetes. Singapore is already committed to tackling diabetes. It is my pleasure to introduce the Prime Minister of Singapore.
Friends and colleagues, tackling diabetes is a major priority for Singapore. 1 in 3 Singaporeans can expect to develop diabetes in their lifetimes, impairing their quality of life in later years. Diabetes is an invisible disease. It does not appear as a top cause of death, but many heart attacks, strokes, and kidney failures, in fact, trace back to diabetes. Diabetes also complicates the treatment of many other diseases, including COVID-19. Singapore declared a war on diabetes 5 years ago. This is a whole-of-nation effort. Believing that prevention is better than cure, we strongly encourage Singaporeans to adopt healthy diets and lifestyles. We are mandating the grading and labeling of ready-to-drink beverages and banning advertising of beverages with high sugar, and saturated fat content. We promote regular physical activity to maintain fitness and reduce obesity. We've built parks and fitness corners all over our island and are happy to see them well used by joggers, cyclists, and exercise groups, old and young. A national health screening program encourages Singaporeans to go for regular health checkups in order to detect early the onset of disease. For those living with diabetes, we strive to optimize disease management, emphasizing prevention of complications. We've set up a diabetes center to bring together different specialists and allied health professionals. The center organizes care around the needs of diabetic patients and aims to raise standards of care, education, and research. Singapore, therefore, strongly supports the World Health Organization's Global Diabetes Compact. Singapore did something similar on a more modest scale 2 years ago, when we hosted an international ministerial conference on diabetes. Let us continue to work together to share experiences in preventing and managing this disease and make our peoples happier and healthier. Thank you.
The Director General of the WHO, Dr. Tedros Adhanom Ghebreyesus, fellow heads of state and government, distinguished ladies and gentlemen, I am delighted to join the World Health Organization and indeed the entire global community as we launch the Global Diabetes Compact and also as we celebrate 100 years since the discovery of insulin. The launch of the Global Diabetes Compact is not only timely, but also an important initiative that will provide a comprehensive approach to the prevention and management of diabetes. Your Excellencies, ladies and gentlemen, while we celebrate the revolutionary discovery of insulin, it is worth noting that diabetes still remains as one of the major health challenges of the 21st century. The number of adults living with the disease has more than tripled over the last 20 years. Why? Basically, because basic diagnostic tests are not available in many low-income countries, and 1 in 2 with type 2 diabetes who need insulin treatment do not, unfortunately, have access to it. People living with uncontrolled diabetes are at risk of developing serious and life-threatening complications, including kidney damage, cardiovascular disease, and eye and foot damage. COVID-19 has also further complicated the burden of diabetes. A recent WHO survey has revealed that 18.3% of COVID-19 deaths, 18.3% of COVID-19 deaths in the African region are among people living with diabetes. In Kenya, approximately 3% of the adult population is living with diabetes. The prevalence is projected to rise to 4.4% by the year 2025, if more aggressive preventative measures are not taken today. Even more worrisome is the fact that over 50% of those with diabetes do not know their status, leading to late diagnosis when complications have already set in. So I'm therefore pleased to note that one of the key objectives of the Global Diabetes Compact is to enhance our capacity, or the capacity of our health systems, to detect, diagnose, and manage diabetes. Ladies and gentlemen, my administration is committed to supporting the Global Diabetes Compact by implementing health system reforms to accelerate the achievement of universal health care coverage. The UHC is our roadmap towards the realization of the right to health, a constitutional right of our citizens. And to this end, I wish to thank the WHO for the support that they have given and lent to Kenya in our rollout of UHC. We are realigning diabetes and other non-communicable diseases service delivery into the UHC framework to make it easier for our people to access quality health care based on need and not the ability to pay. In this context, my administration has ensured that a chronic illness package is included in the Enhanced National Health Insurance Scheme, which is currently available to any Kenyan who wishes to enroll. Finally, ladies and gentlemen, I wish to thank once again the World Health Organization and all our other partners for supporting Kenya with insulin and other supplies as part of the COVID-19 strategic preparedness and response plan. This support was and will continue to be critical in saving lives of persons living with diabetes by helping them maintain blood sugar within recommended levels and thereby moderating the severity of the COVID-19 illness. Thank you all for contributing to our shared vision of a world free of preventable diseases and preventable diabetes in particular, as well as all other related non-communicable diseases. Let us accelerate action on this agenda as we prepare for the second high-level meeting of the United Nations General Assembly on universal health coverage in the year 2023. I thank you all for your kind attention.
Excellencies, ladies and gentlemen, friends, today we are celebrating an important medical breakthrough, 100 years since the discovery of insulin. Despite this breakthrough, 1.6 million people still die from diabetes every year. It's one of the world's top 10 causes of death. People are dying because they do not have access to quality healthcare services and affordable insulin. Many are not aware that they have the disease and are diagnosed post-mortem. This is unnecessary and unacceptable. Diabetes and other non-communicable diseases account for more than 70% of all deaths worldwide. Most deaths from NCDs in people under the age of 70 occur in low and middle income countries. This is also where 4 out of 5 adults with undiagnosed diabetes live. A large-scale global effort to combat NCDs could save millions of lives, improve the health of populations, and enhance economic growth. This is crucial for achieving the Sustainable Development Goals. But only 1% to 2% of global health-related development assistance go to combating NCDs. This is why my government has adopted a strategy for combating NCDs as part of our development policies. We have allocated about $130 million over 5 years to this work. And I'm proud that the World Health Organization is our main partner. We recently launched the WHO Norway Flagship Initiative. This includes concrete actions to combat NCDs, such as strengthening primary healthcare capacity and access to medication. The program is being implemented in Ethiopia, Ghana, Myanmar, and Nepal. I would like to congratulate Dr. Tedros, Dr. Bente Mikkelsen, and the rest of the NCD team on the launch of the Global Diabetes Compact. Access to insulin is crucial. Better prevention, screening, early diagnosis, and care are also needed. The Global Diabetes Compact will help find solutions to enable people with diabetes to live long and healthy lives. Diabetes has been treatable for 100 years. It is time we ensure that the treatment is made available to all. Thank you.
Buluvanaka from Fiji. Thank you to the Director General of the WHO, Dr. Tedros, and my fellow leaders for enlisting in this effort to save lives and spare suffering from the scourge of diabetes. NCDs, like diabetes, are the greatest health crisis Pacific people face today. I say that knowing full well we are in the midst of a pandemic. Given the cruel manner in which the coronavirus preys on those most vulnerable, few live with a crushing fear of contracting COVID-19 like those living with diabetes. Those who do need our support more than ever. Fijians suffer from diabetes well above the global average. Knowing the risk that posed, we acted quickly to keep the virus at bay. It took us 30 days to contain our outbreak of COVID-19, and this month marks 1 full year since our last local case. NCDs, however, are a crisis with no clear end. It will take far longer than a single month, a single year, or even a medical marvel like a vaccine to defeat diseases like diabetes. Instead, we must change hearts and minds across society by raising awareness about how we stop this disease from stealing so much from our people. And we must ensure those who suffer from it can access the best care possible. In Fiji, around 15% of our population are diagnosed with a type of diabetes. The real prevalence is likely much higher. Regardless, what we do know is shocking. Fiji loses out on over $400 million a year in productivity, and our people lose more than 264,000 years of healthy living due to NCDs. Those are the raw numbers, but they cannot capture the true weight of the pain our people endure. Feeling your mobility slip away, missing time with your children, watching loved ones leave too soon, none of that heartbreak can be calculated, but it can be averted. In Fiji, we are equipping our health facilities to offer better and more affordable health care to Fijians living with diabetes and other NCDs. We are helping our people help themselves through access to better information, outdoor recreation, and more nutritious food. But the economic crisis that has come with the pandemic puts all that work at risk. The sooner we get our people vaccinated, the sooner we bring our tourism-driven economy back to life, the more progress we'll make against this disease. It's that simple. Fiji was a proud signatory to the pandemic treaty to protect humanity from a future that looks anything like the past year. Today, we are equally proud to enlist in WHO Global Diabetes Compact. Once again, it is about saving lives through solidarity. Once again, Fiji is ready to play its part. Thank you.
The WHO Ambassador for Non-Communicable Diseases and Injuries is Michael Bloomberg. You're about to find out why he's such a fine ambassador.
This year has been especially hard for the hundreds of millions of people living with diabetes. They have been at much higher risk of contracting a severe case of COVID-19, and it has become much harder to get the life-saving insulin they need. Diabetes is one of the top 10 causes of death globally. 4 out of 5 adults in lower-income countries are unaware that they are diabetic, and 30 million type 2 diabetics have not had access to insulin. The good news is that this is solvable. 50 million deaths could be prevented by implementing tax increases that raise the price of tobacco, alcohol, and sugary beverages. And that's just one thing we can do. Bloomberg Philanthropies has been working to protect people from non-communicable diseases like diabetes for years. And I'm also glad to serve as WHO Global Ambassador for Non-Communicable Diseases and Injuries. Today, the WHO is taking action by launching the Global Diabetes Compact. This pandemic has proved the importance of investing in preventive measures like this now in order to save lives in the future. So I want to thank the WHO for leading this global response. We'll be with you every step of the way.
UNICEF is proud to join today's launch of the Global Diabetes Compact with WHO and the University of Toronto. An important new opportunity to shine a light on the risks of non-communicable diseases like diabetes. The discovery of human insulin 100 years ago is one of the most significant advances in the history of medicine, one that transformed the lives of millions of people with insulin-dependent diabetes. But today, the majority of more than 1.1 million children and adolescents with type 1 diabetes do not have access to screening, early diagnosis, and adequate care, including the insulin they need to survive. Historically, global health efforts have focused on combating infectious diseases. This focus has left health systems and responses ill-prepared to detect and treat non-communicable diseases like diabetes, and to minimize other NCD risk factors like overweight and obesity, lack of physical activity, and alcohol and tobacco abuse. These risk factors can begin early, but their effects can last a lifetime. As we seek to better recover from the COVID-19 pandemic, we need to build stronger primary health systems that can address both infectious and non-communicable diseases like diabetes. Through this new compact, UNICEF is proud to join forces with the public and private sectors to shape markets and strengthen the supply chain to make insulin more affordable. We also need to work together to better regulate the promotion of products like sugary drinks, tobacco, and alcohol, especially to children. And we call on governments to make NCDs like diabetes the priority in national budgets and to set bold targets around diagnosis, treatment, and access to insulin. UNICEF looks forward to working with our partners around the world to bring this compact to life and to ensure that every child everywhere can enjoy a healthy and productive future. Thank you.
If you have diabetes, taking care of your health is critical. I remember when my dad was diagnosed with type 2 diabetes and how careful he was about taking his insulin injections regularly and just really looking after himself. You are about to meet 3 people with diabetes who not only watch their own health, but they're activists and advocates for people with diabetes in their own community. So they're looking after other people as well. We spoke recently. I am going to let the activists introduce themselves to you. Hello everybody, this is a great bit of the Global Diabetes Summit where we get to talk about real people making real change. Hello advocates, hello champions. I'm going to get you to say hello to our audience one by one. Pei-Yen, you start.
Hi everybody, I'm Pei-Yen from Singapore. I've been living with type 2 diabetes for 25 years and I'm representing Vida Change.
Hi there, my name is Zeem Farhat. I've lived with diabetes for the past 14 years. I come from Lebanon and I represent Positive on Glucose.
Hello, my name is John Peter Moro. I come from Tanzania. I have type 1 diabetes for 15 years. I represent T1 International.
I'm always curious about what turns someone into an activist. At one point, you discovered you had diabetes. What was the moment when you realized that you wanted to work really hard to get a better life for other people who have diabetes like you? What happened? When did that happen?
It was 2016, and it happened when I was at the college studying medical laboratory. So when I went back home for field studies at the hospital, and I saw a lot of kids who are diagnosed with type 1 diabetes especially, where most of them didn't survive. Many of them died at the hospital, and some of them were discharged or were some of them were discharged and they were never coming back for clinics. The other thing that made me turn to advocacy was I saw a girl in Dar es Salaam who, because of their family economy, she was not able to buy her insulin. So the insulin she got from the hospital, she used to mix it with the rainwater so that the insulin can stay longer. That was very painful because that girl died. And I decided to change and start advocating for everything that diabetes and the people with diabetes needs, including strips. Myself, I stayed for 6 months without checking my blood glucose at all, except when I went for clinic. That's the only place where I was able to check. The other days, I was just staying like I am okay, whether it is my blood sugar was up or down. I didn't know because I was never checked it for almost 6 months. That's when I met Elizabeth of T1 International, and from there everything changed, and I started to advocating for diabetes in general, especially for type 1 diabetes.
I think the main thing that happened was my dad was diagnosed with type 2, and for 1 second it was not just me advocating for myself, it was time to advocate for my dad and to teach my dad. And I looked around and there was no community, no rights, no one asking or fighting for, the rights of people living with diabetes. And I was like, that's it. If no one's doing it, I'm going to do it myself. So I remember that bright and clear.
When you say the issues or the challenges that the diabetes communities around the world have, what are you fighting for? What are you pushing for?
I guess it's all about awareness, and it's not just awareness within the public community. It's also awareness from the public, members of the public, awareness within the diabetes community itself. How do we interact with each others in a safe environment, and the type of language that we use to address each other, during discussion when it comes to anything that's related to diabetes.
I think some of the most recent challenges that I've personally gone through were during the COVID pandemic, we were not on the priority list, we were not considered high risk. One of the things that I've personally struggled with was the lack of education, even at the medical level, you go start an NGO for supporting people in terms of psychiatry and mental health, and they laugh at you. They're like, that's not important for diabetes. There are so many things people with diabetes need other than just the tools. They need the support system, they need the community, they need the mental health support, because they easily slip into anxiety and depression, and that leads to lack of management, and that could lead to many, many bad outcomes. And in the diabetes talk, we don't talk about these things a lot. So we need insulin, but we also need mental health awareness. We also need support from the world of nutrition. We have other needs that are unfortunately very expensive that no one talks about. They have to acknowledge our needs and see us as people with a critical condition. And that's the first step. Unless that happens, I don't know how change happens in a country like Lebanon and several other countries in the MENA region.
Pei-An, you are sitting in Singapore, so it's going to be a different situation there. How knowledgeable are governments, your government and governments in the region, about diabetes? How are you faring?
Well, I guess for us in Singapore, we are trying very hard to really create awareness about what diabetes is, whether in schools and the public, creating awareness amongst the community. On a whole, in the Western Pacific region, it's a mix. Yeah, there are countries who are doing pretty well in terms of awareness and understanding of what diabetes is. But at the same time, we also have countries in the Western Pacific region which really need support and help in terms of creating awareness about diabetes.
Let's talk action now. And how do you create a situation where governments are more aware, they're doing meaningful engagement, and people with diabetes around the world are getting the help that they need? Surin.
I think that people with diabetes have been trying to talk about this and raise this topic, and we are finally heard. Governments have a very important role here. The compact, without governments actually making it happen, unfortunately won't be the breakthrough we are all hoping for. But being heard is not enough. We need meaningful action, we need engagement, we need to be included in the decision making, and we can help governments find solutions. We can use synergy, we can be team players and make meaningful impact in the world if we are allowed to. They just have to listen to us.
It's all about, people, leaders, government coming together, talking together, and sharing what is going on in their own country. You might not know, you might never know. Another country may just say, "Hey, I have a solution for this," or I have a problem. Can anybody help me with this? Or if anybody has a good idea that you have tried and it worked, maybe can share with me what is your policy or how do you implement it in your country. One way to start this is really through education, how we integrate the understanding of diabetes, whether is it superficial or whether is it a bit more in-depth, into the curriculum. So for example, my students, they are learning about what exactly is diabetes and some signs and symptoms, causes, how it can affect a person's life in their curriculum in school.
My suggestion is to spread the awareness to the community through schools, and they can try to make diabetes, they can put diabetes into the curriculum so that the kids can learn diabetes from their schools, and also support us, the people who are living with diabetes, to go around the community, schools, and everywhere where there are people, and teach them about diabetes, so that we can be able to live free. Because right now, a lot of students are first of all, to supply the necessities of diabetes, insulin, test strips, to the hospitals, so that everyone with diabetes can get them for free. And also to try to help us to spread the awareness of diabetes, just the same as they did for HIV. We want the community to understand diabetes, and we want the community to accept the people with diabetes.
As a final remark, I would like governments to look at the COVID pandemic and how much they've done in a year after the storm. And I want them to look at the resources, how they synergized, how they collaborated to find a vaccine. And I want them to compare that to the diabetes pandemic that's been happening for a very long time. And the fact that it's been 100 years since insulin, and that there are still people dying because they don't have access to medication.
I'm just going to make it very short and simple. Come talk to people living with diabetes and hear our stories.
There are 420 million people living with diabetes, and it's quadrupled since 1980.
We all know someone with diabetes, or we all will know someone with diabetes. Maybe a person with diabetes in your life doesn't feel comfortable talking about it because of the stigma and shame surrounding it.
Data from OECD, data from WHO really shows that there is a substantial increase in the number of patients that we are seeing with diabetes.
Now that we are here 100 years after the discovery of insulin, I think that the global community is really recognizing that there's still so far to go.
You still have people who can't afford it. You still have places that say we can't store insulin because we don't have a cold chain system.
In 2021, it's predicted that 235 million people globally will need humanitarian assistance, and it's particularly challenging for people living with diabetes.
The Global Diabetes Compact is a golden opportunity to come together and focus on how to support people already living with diabetes, but also to prevent people from getting type 2 diabetes. It's a journey that is just started. And I think that's a really good thing, because that means that everybody can come on board and give their advice.
As a person with diabetes, it feels great to be connected with others around the globe who are going through a lot of the same issues that I experience.
If you look at HIV, this was really part of the success, the game changer, that people living with HIV started to be very vocal on what kind of solutions they need.
In rural Zimbabwe, a person cannot be diagnosed in a primary healthcare facility because we don't have the resources, we don't have the people who can do that. So this compact is aiming at that, training people at the root.
I think that the root of diabetes care should really come from primary care physicians, because that's who you'll most likely see. Primary care physicians should be trained to be supportive of their patients' mental well-being as they either adjust to life with diabetes or as they go through whatever types of things that life throws at them that may impact their diabetes management.
Bringing diabetes into primary care is essential. The earlier we can start to treat these patients and minimize the impact that diabetes can have in the vascular system, the better results we can have.
Insulin has been around for 100 years, but we have 3 major companies that are dominating the market.
The greatest opportunities for increasing access to insulin, particularly in low and middle income countries, is really better access to greater competition in the form of biosimilar insulin. There's a number of barriers currently preventing that from a systemic perspective, but we really think the Global Diabetes Compact provides us the opportunity to engage with the private and the public sector on what exactly are those barriers to reduce the time and cost associated with bringing these biosimilar products to market.
Maybe with the compact, we'll have more manufacturers of insulin, better pricing of insulin, price caps. We need all those things.
What I really hope with the compact is that we think about the most vulnerable and the most challenging circumstances. If we can address the needs in humanitarian settings, in low resource settings, firstly, we're helping those who are most vulnerable and most in need. And secondly, the lessons learned and the solutions found for those areas can probably be useful for people living with diabetes everywhere.
I am so passionate about trying to break down the barriers to ensure that the health systems that we work with today are built to sustainably provide the access that people need in years to come.
I commend Dr. Tedros, our Director General, that he really picked up on this idea and supports it. I want to focus on solutions, and I can see that all the people who are interested in joining the compact has the same idea.
The next 5 years could bring so much positivity in the diabetes world.
People who live with and work with diabetes excited about the possibilities of the WHO's Global Diabetes Compact. The compact is being launched in the anniversary year of the discovery of insulin 100 years ago. Insulin is on the WHO's list of essential medicines, but for many, it is very difficult to get hold of and also difficult to be able to afford. You're about to hear from people really talking about the challenges of equitable access to everybody to insulin as a medicine. But first, we're going to stop off at the University of Toronto in Canada, where they made the best deal of all time, paying $1 for the patent for insulin. Here's Professor Gertler with the story of the discovery of insulin in Canada.
Before the discovery of insulin, diabetics faced a life expectancy of only a few years after onset of the disease. In 1921, Frederick Banting, Charles Best, and James Collip, working under the direction of J.J.R. MacLeod in the University of Toronto's physiology labs, developed and purified a pancreatic extract that was safe and effective in human trials. Insulin was produced initially in U of T's Connaught antitoxin laboratories beginning in 1922. Banting and MacLeod would win the Nobel Prize in Physiology and Medicine in 1923 for a discovery that has profoundly improved the lives of millions of people around the world. That same year, Banting, Best, and Collip were awarded the patent for their discovery, which they promptly sold for $1 each to U of T to ensure that insulin would remain readily available to any and all who needed it. And yet today, insulin is still out of reach for millions around the globe, and its cost and accessibility have become a major challenge for public health and public policy the world over. The discovery of insulin is one of the most important accomplishments in the history of medicine, and the University of Toronto is enormously proud to have played a leading role in this breakthrough. It is in this spirit that we are so pleased to help launch the Global Diabetes Compact. Thank you all for your dedication to this great cause.
One of Canada's proudest achievements is the discovery of insulin right here in Ontario 100 years ago. Insulin revolutionized the management of diabetes and literally saved millions of lives around the world. Yet, a century later, the problem of diabetes is bigger than ever. Today, 1 in 3 Canadians has diabetes or prediabetes, and young people in Canada face a greater than 50% chance of developing diabetes in their lifetime. That's why here at Diabetes Canada, we have been urging our governments to embrace a comprehensive nationwide approach to improve the prevention, screening, and management of this disease. Diabetes Canada, along with 120 stakeholders from multiple sectors across the country, was inspired to develop this approach, which we call Diabetes 360, based on the success the HIV/AIDS community has had with their 90-90-90 target. Here at Diabetes Canada, we are confident that with an inclusive, holistic, and equitable approach to addressing diabetes, we can chart a path that will ensure that Canada and other countries around the globe improve the care that is offered to people living with diabetes. That's why we're so pleased to be here today, and would like to thank the World Health Organization for convening this session, not only to commemorate an amazing discovery made 100 years ago right here in Canada, but also to launch the WHO Diabetes Compact. This compact represents another important step towards our shared vision. We all want to create a world free of the effects of diabetes. And we all agree we can't wait another 100 years to end diabetes. Thank you.
Living with diabetes is like rebuilding a house around you every day. Some days the house is solid, keeping you safe and warm. Other days the roof blows off before breakfast. At the foundation of this house is insulin. 100 years ago, there was no house to build. This miracle medicine changed lives and gave people with it the option to live. Now at the centenary, this fundamental unit of care is still unaffordable to 1 in 2 people in need. In low and middle income countries, some on a low wage must work up to 10 days a month just to purchase 10 mils or 1 vial of insulin. And beyond the price tag, insulin in the public and private sectors often fails to meet WHO's Global Action Plan target of 80% for availability. At this summit, there's an opportunity for all of us to come together to make real commitments for change. Prioritizing access to insulin in global diabetes policy, committing to and designating resources to diabetes care in national settings, committing to more evidence on insulin use and access in low and middle income countries, committing to transparency across the sector, and committing to joint advocacy around this critical issue. In this moment marking the discovery of insulin, we have an opportunity to change this issue for the better and ensure all people in need have a solid foundation that allows us to build on and improve diabetes care for all. Thank you.
The question we have to ask ourselves is why, 100 years after Frederick Banting and his team donated the patent for insulin to the University of Toronto for $1, thousands are dying worldwide every year due to affordability issues from diabetes. No man, woman, or child should die for lack of access to insulin in 2021. In India, a diabetes diagnosis for many is effectively a death sentence. The cost of insulin is as much as 3/4 of a poor family's monthly income and leads to parents making the terrible decision between keeping the child alive and feeding their other children. Poor management of diabetes and inconsistent supply of the drug lead to debilitating health issues. Families still sleep on train platforms overnight as they travel across the country to receive free medical care. Life does not have to be like this. With the correct medical support, children we work with are thriving, attending education, and looking forward to a sustainable and healthy future. Those with diabetes worldwide deserve the chance to dream.
Today, 1.1 million children and adolescents live with type 1 diabetes, and many suffer from entirely preventable severe disease and complications. These complications and traumatizing experiences of being critically ill will affect their lives forever. It is not easy being a child with a chronic condition, but if you are one, you do have the right to the highest attainable standard of health according to the UN Convention on the Rights of the Child. However, despite the fact that all people with type 1 diabetes and about 60 million people with type 2 diabetes need insulin, only less than half of low-income countries have general availability of insulin in the public sector. We must ensure better access to medicines and equipment that is affordable and of high quality to all. Additionally, we emphasize the need for improved training of healthcare workers in the field in order to improve diagnostics, treatment, and care standards globally. We're also concerned about the mental health effects of people living with diabetes and believe that schools and communities can be important platforms for support and general management of the disease. Finally, we call on decision makers to engage children and young people in political and programmatic processes in order to achieve meaningful collaborations between generations so we can move forward in the fight against diabetes together.
Have you noticed that delegates at the Global Diabetes Summit, they're coming up with solutions, not just mentioning the problems? The challenge: equitable, comprehensive, affordable, and quality treatment and care for all. Part of the solution, well, how about resilient healthcare systems that can handle prevention, management, and treatment for everybody? You're about to hear from ministers of health and how they intend to tackle diabetes more effectively in their countries. We start with the Minister of Health for Oman.
Your Excellencies, distinguished guests, my dear friend and brother Dr. Tedros, ladies and gentlemen, greeting from Oman. It gives me great pleasure to address you at this important event. And I would like to take the opportunity to congratulate the World Health Organization on the launch of the Global Diabetes Compact. I would also like to extend my greeting and thanks to the University of Toronto and to everyone on the 100th anniversary of the discovery of insulin, which is a life changer for those who suffer from diabetes. Diabetes continues to be a major public health burden. This debilitating illness is one of the leading causes of premature death, morbidity, and loss of economic growth worldwide. Here in Oman, and over the decades, diabetes continued to be our priority, and numerous interventions have been introduced with the aim of ensuring holistic and multidisciplinary approach for individuals affected by it. In early 1990, the diabetes services were integrated in our primary health care, and today all our primary health care facilities run diabetic clinic where patients are managed by qualified teams trained in provision of diabetes management and counseling, along with the ability to detect early complication and refer to higher medical services. However, diabetes continues to be a growing burden in Oman. At present, more than 15% of our population are known to be diabetic, and we diagnosed more than 6,500 new cases a year. In addition, unfortunately, 35% of our population are overweight, and 30% are reported to be obese, with most alarming and growing trend amongst women and children. Dear colleagues, COVID-19 pandemic has demonstrated the vulnerability of those living with diabetes, with higher rates of mortality and morbidity. Moreover, the pandemic has also resulted in the disruption of essential services, particularly screening and early detection, and this will undoubtedly result in late diagnosis of the disease and delay in detection of disease-related complications. Ladies and gentlemen, there is an urgent need for us to respond to this growing burden of diabetes and invest in all means to control it. Our work needs to ensure equitable and affordable access to treatment, and it's essential that we advocate for investment in diabetes education and prevention programs. Finally, I applaud WHO for their efforts towards drawing the attention to this devastating illness and for ensuring the dissemination of the correct messages through high-level platforms. I am sure the Global Diabetes Compact will serve as an important tool for all countries. Thank you very much.
Monsieur le directeur général de l'Organisation mondiale de la santé, mesdames et messieurs les ministres, chers collègues, mesdames, messieurs, en ce 14 avril 2021, je suis heureux et même honoré de pouvoir me joindre, virtuellement bien sûr, au lancement du pacte mondial de l'OMS contre le diabète. D'abord en tant que médecin, puis ancien parlementaire, et maintenant en tant que ministre, je sais combien le diabète reste une épreuve qui bouleverse le quotidien de tant de personnes dans le monde. Nous célébrons aujourd'hui le centenaire de la découverte de l'insuline, l'une des innovations médicales les plus significatives du siècle dernier. En dépit des avancées extraordinaires que cette découverte a permises, la prise en charge du diabète constitue toujours à l'échelle globale un enjeu majeur de santé publique. Or, nous savons que la pandémie de la Covid-19 a fortement perturbé les services de prise en charge, alors même que les personnes atteintes de diabète sont particulièrement exposées aux formes graves de la maladie. C'est la raison pour laquelle nous avons besoin d'une mobilisation politique et d'engagement collectif fort. Je tiens à remercier chaleureusement le directeur général de l'OMS pour le leadership de son organisation, ainsi que l'ensemble des acteurs mobilisés aujourd'hui, comme au quotidien, pour leur engagement. Aussi, je pense que nos échanges doivent pouvoir traiter en priorité de l'universalité de l'accès à la santé, c'est-à-dire à des services de santé et des médicaments sûrs, abordables, de qualité, pour le dépistage précoce, comme pour le traitement du diabète. Également de la lutte contre les inégalités de santé et du respect des droits humains, en particulier des personnes malades. C'est autour de ces axes forts que nous avons développé, en France, une approche à la fois populationnelle et individuelle, à même de créer un environnement favorable pour la santé et en s'appuyant sur la mobilisation de la société civile, des associations de patients et de patients experts. Populationnelle par le développement de politiques globales de prévention, de repérage, de dépistage et de prise en charge précoce des pathologies chroniques. Cela passe par exemple par une meilleure organisation des soins de proximité et la mise en place de protocoles de coopération pluriprofessionnelle. Individuelle ensuite, en favorisant un accompagnement personnalisé des personnes diabétiques ou à haut risque de développer un diabète, à même de renforcer leur autonomie et leurs compétences, et ainsi leur rôle en tant qu'acteurs de la santé. Cela passe par exemple par la mobilisation d'outils de santé numériques et par un accompagnement à distance sur l'ensemble du territoire national, permettant d'assurer un accès à tous les dispositifs de prévention, de prise en charge et d'accompagnement. Mesdames et messieurs, La réunion d'aujourd'hui constitue une opportunité unique. C'est le bon moment pour aborder collectivement ces enjeux et témoigner de notre soutien au pacte mondial de l'OMS contre le diabète. L'ensemble des acteurs mobilisés, nationaux et internationaux, publics et privés, ont un rôle clé à jouer et une responsabilité majeure dans les efforts de lutte contre le diabète et le renforcement de leur système de santé public et communautaire. Aussi, j'en appelle à la pleine mobilisation de tous pour faire de cet événement une réussite collective à la hauteur des enjeux qui déterminent nos actions et qui nous rassemblent. Je vous remercie.
Assalamu alaikum, ladies and gentlemen. I am so pleased to see the World Health Organization Global Diabetes Compact being launched today with the aim of making diabetes treatment accessible for all the ones in need. Today, we remember with gratitude the selfless contribution of Mr. Frederick Banting, a pioneer in the field of diabetes treatment. Almost 100 years ago, Mr. Banting co-discovered insulin and made it available to the world by selling the patent for only $1 to the University of Toronto. Because of epidemiological transition, the disease burden is shifting from communicable to non-communicable diseases in Bangladesh. Non-communicable diseases are now estimated to account for 67% of all deaths in the country, with around 8.3% of adults currently having diabetes. Bangladesh has a long history of combating diabetes. In 1956, our national professor, Dr. Muhammad Ibrahim, established the Diabetic Association of Bangladesh on the foundation with no diabetic patients should die untreated, unfed or unemployed, even if she or he is poor. And later on, the Bangladesh Institute of Research and Rehabilitation in Diabetes, Endocrine and Metabolic Disorders, popularly known as BARDEN, was established, and it is now an internationally recognized institution. We have a great legacy to carry on, and we committed to do so at the United Nations General Assembly on non-communicable diseases in 2018. Bangladesh is focusing very much on strengthening screening and service delivery for diabetes, especially at primary healthcare settings, including community clinic and sub-district health complex. In 2019, our Director General of Health Services adopted the second edition of National Protocols for Management of High Blood Pressure and Diabetes in many primary healthcare settings, developed with WHO technical support. The protocols include guidelines for the detection and management of diabetes at field level. We are also ensuring the supply of necessary diagnostic tools, agents and medicines at all levels of public healthcare facilities. Following the resolution adopted by the United Nations General Assembly in September 2020, our agenda foresees the further strengthening and enhancement of these actions and services to ensure a wider protection and treatment of people living with diabetes who are at higher risk of contracting COVID-19. Under the umbrella of Essential Health Service Package, also aiming at achieving universal health coverage, we will continue and improve the implementation of WHO package of essential non-communicable disease interventions, especially at primary healthcare settings. We reiterate our commitment in the fight against diabetes today. With sincere gratitude to the organizers of this important event for inviting me and allowing me to send this message. Thank you.
Уважаемые коллеги, от лица Министерства здравоохранения Российской Федерации и от себя лично рад приветствовать вас на сегодняшнем совещании. Проблема сахарного диабета является широко распространенной и входит в число неинфекционных заболеваний, наиболее часто приводящих к инвалидизации и смерти людей. Катастрофический рост числа заболевших во всем мире принимает характер неинфекционной эпидемии. В этой связи необходимо скоординировать совместные усилия всех стран для решения этой глобальной проблемы. В Российской Федерации проблеме сахарного диабета уделяется особое внимание. Реальный прорыв в качестве оказания помощи гражданам России произошел в 1996 году благодаря государственной поддержке этого направления правительством Российской Федерации и утверждения целевой программы «Сахарный диабет». Решающим фактором, определяющим качество жизни больных сахарным диабетом, является его раннее выявление. Значительный вклад в своевременное выявление сахарного диабета вносит всеобщая диспансеризация населения, в рамках которой проводится скрининг на выявление данного заболевания. Обеспечение пациентов с сахарным диабетом своевременным и качественным лечением является критически важным и позволяет избежать прогрессирования болезни, развития тяжелых осложнений, инвалидизации. В Российской Федерации лекарственные препараты, необходимые для людей, больных сахарным диабетом, входят в перечень жизненно необходимых и важнейших лекарственных препаратов, который утверждается правительством Российской Федерации. Пациенты в Российской Федерации бесплатно получают не только генно-инженерные инсулины человека, но и инновационные аналоги инсулинов ультрадлинного и ультракороткого действия, а также неинсулиновые препараты с доказанными кардио- и нефропротективным действием. Необходимо отметить, что большое значение в борьбе с сахарным диабетом в России уделяется вопросам рационального питания и достаточной физической активности в рамках реализации федерального проекта укрепления общественного здоровья. Уважаемые коллеги, Российская Федерация всецело разделяет озабоченность мировой общественности проблемами неинфекционных заболеваний и, в частности, проблемой сахарного диабета. Наша страна приняла на себя ответственность в выдвижении этой проблематики в число ключевых вопросов, рассматриваемых не только Всемирной организацией здравоохранения, но и в ООН. Кроме того, Россия взяла на себя большую долю финансирования направления в этих организациях. В рамках функционирования в Москве географически удаленного офиса Всемирной организации здравоохранения по неинфекционным заболеваниям, деятельность которого финансируется правительством Российской Федерации, мы оказываем помощь странам, имеющих высокие показатели смертности от неинфекционных заболеваний, в том числе и сахарного диабета. В заключении позвольте выразить благодарность организаторам и участникам сегодняшнего мероприятия, и мы призываем всех объединить усилия для борьбы с этим опасным заболеванием, поиска новых методов лечения, новых методов профилактики осложнений. Благодарю вас за внимание.
Monsieur le Président, Mesdames, Messieurs, en vos rangs, titres et qualités. Le Sénégal se réjouit de participer à cette réunion de lancement du pacte mondial de l'Organisation mondiale de la santé pour la lutte contre le diabète, qui marque le 100e anniversaire de la découverte de l'insuline, et félicite le secrétariat pour le travail de coordination et de préparation. Les problèmes sanitaires auxquels sont confrontés les pays, notamment le lourd fardeau des maladies non transmissibles telles que le diabète, nécessite une action concertée et régulière de tous les acteurs de la santé et du développement. En effet, 2/3 des personnes atteintes de diabète sont en âge de travailler. Cette maladie représente ainsi un fardeau économique pour tous les pays du monde et nous savons qu'une population en mauvaise santé constitue un frein au développement. Les pays sont conscients du fait que les maladies non transmissibles, y compris le diabète, pourraient compromettre les progrès vers l'atteinte des objectifs de développement durable à l'horizon 2030, si des mesures efficientes et urgentes ne sont pas prises. C'est pourquoi le président de la République du Sénégal, son Excellence M. Macky Sall, a très vite compris, en inscrivant dans l'axe 2 du plan Sénégal émergent, le développement du capital humain et la protection sociale, dans une dynamique de couverture sanitaire universelle. Nous soutenons les mesures de la stratégie de prise en charge des maladies non transmissibles par l'OMS, qui a impulsé la décentralisation de la prise en charge du diabète, notamment le renforcement des mesures de dépistage et de traitement précoce de cette maladie, surtout à travers son intégration dans les soins de santé primaire. En effet, au Sénégal, 11 cliniques de traitement du diabète et de l'hypertension artérielle et un plan d'extension est en cours pour réduire les complications et la mortalité liées au diabète. S'agissant du traitement, la subvention de l'insuline est passée de 300 millions à 500 millions durant l'exercice 2022. Les antidiabétiques oraux sont également disponibles dans les structures de premier recours. Il convient de signaler qu'une application mobile dénommée M-Diabète est utilisée depuis 2014 pour sensibiliser les populations sur la prévention et la prise en charge du diabète. Par ailleurs, la prise en charge du diabète sera renforcée par l'octroi de bourses de spécialisation en endocrino-diabétologie. Nous tenons à féliciter l'OMS qui, malgré ce contexte sanitaire difficile, a maintenu le niveau d'information avec les États membres en permettant une dynamique d'échange dans le cadre de la prise en charge des maladies impactées par la Covid, telles que le diabète. Je souhaite plein succès aux résolutions prises dans le cadre du lancement du Pacte mondial de lutte contre le diabète, en espérant que les résiliences développées dans nos pays nous permettront d'atteindre les objectifs fixés pour contrôler cette maladie. Pour conclure, le Sénégal invite l'OMS et les partenaires internationaux à poursuivre le soutien aux États membres dans la disponibilité de l'insuline, le renforcement de leurs capacités, le dépistage et le traitement du diabète, ainsi que la lutte contre les facteurs de risque. Je vous remercie de votre aimable attention.
Excellencies, ladies and gentlemen, today is a historical day. We are all here to launch a unique initiative, the WHO Global Diabetes Compact, uniting around a common agenda for reducing the risk of diabetes and ensuring that those diagnosed with diabetes have access to quality care and treatment that is equitable, comprehensive, and affordable. Today was the most appropriate day for launching this initiative as the world completes 100 years since the discovery of insulin. And of course, this initiative is a monumental step being taken to catalyze access to healthcare services for people of all ages living with diabetes. In India, it is estimated that around 5.8 million deaths occur due to non-communicable diseases, which account for 61% of the total deaths. Also, an estimated 60 to 70 million people suffer from diabetes. In this respect, my government has launched an ambitious and aggressive national program for prevention and control of diabetes, which is being implemented for intervention up to the lowest administrative level. Awareness for prevention, early detection, a massive advocacy drive, and provision of insulin at all public health institutes are steps being taken aggressively. We are committed to ensuring affordable life-saving medicines for treatment of diabetes to all, especially the underprivileged. Dear friends, for more than a year now, the world has been grappling with one of the worst pandemics ever in history. And it is also a reality that an effective response to the diabetes problem has been hampered during the pandemic, which needs to be redressed without delay. I assert that we must collectively call on all political leaders and governments across the world to make good on their UN commitments with decisive, inclusive and accountable leadership and appropriate investment. If we are to reach the 2025 non-communicable disease targets and 2030 sustainable development goals. The case to act has never been more urgent. Let us not lose a single opportunity to act well in time. With these words, I thank you for inviting me to speak today at the launch of this unique initiative. Thank you.
The WHO's Dr. Hans Kluge is a champion of action when it comes to tackling non-communicable diseases across Europe. He joins us now to talk about the management of diabetes and the importance of people-centered care. Dr. Kluge, over to you.
Dear friends, colleagues, it's a pleasure to be with you. In the European region, diabetes places a considerable burden on health systems and populations. According to WHO figures, over 60 million people in the region have diabetes, often alongside other conditions. In past months, we have found that diabetes is a risk factor for severe COVID-19 disease and death. We also know of the interplay between diabetes and other communicable diseases such as TB. The urgency of today's launch becomes even clearer in the light of relatively low coverage of diabetes health services compared to progress of services for communicable diseases. Investing in diabetes prevention and management, while acknowledging the link between communicable and non-communicable diseases, leads to better health outcomes, something I have experienced myself as a practicing physician. In other words, putting people at the center. When it comes to investments in treatments of comorbidities in the region, we have some important lessons to draw on. For example, learnings on similarities between HIV and NCD chronic care programs, with similar challenges in supporting long-term adherence to recommended treatment and monitoring of treatment outcomes. These are lessons on integrating comorbidity management using a people-centered approach, a step towards universal health coverage and in line with WHO's European Programme of Work. Congratulations on today's landmark.
Still to come in our summit, Dr. Juliana Chan and Dr. Tom Frieden, they will be talking about the global impact and global range of diabetes. Do you remember earlier when I mentioned that my dad had type 2 diabetes? I've never talked about that in public before, but what you will notice about this summit is that many of the participants, the speakers, are very comfortable sharing that information with you. So for instance, Mark Bowen, you're about to hear from him, type 1 diabetic. Fernando Alcantara Huichas, type 2 diabetic. Very happy for you to know that information. Let's start with Mark. Hi there, Mark.
Hi, it's an honor to speak in such an important historic moment. While we celebrate the centennial of insulin, we need to build resilient health systems to realize the Global Diabetes Compact's vision of reducing the risk of diabetes and ensuring that all people diagnosed with diabetes have access to equitable, comprehensive, affordable, and quality management. For this, we need to work together, all the sectors and stakeholders, the private, the public, and the civil society. People living with diabetes need to be invited to the decision table in order to build together the best policies and programs to provide care and medications they need to have their lives without complications. Thank you very much.
Buenos días a todos. A nombre de la Federación Mexicana de Diabetes Asociación Civil, me dirijo a ustedes para hablarles acerca de la importancia de la educación en diabetes y lo fundamental que es promoverla en el mundo. La educación es un derecho que tenemos los seres humanos y es la base para el desarrollo de cada país. Sabemos que la diabetes está creciendo a pasos agigantados y solo la contrarrestaremos con educación. Debemos crear programas educativos en cada uno de nuestros países dirigidos a los niños. Los adultos también deben recibir educación para saber manejar su condición o prevenir la diabetes tipo 2. Solamente así lograremos generar un cambio verdadero. Hoy estar educados en diabetes es primordial. En la Federación Mexicana de Diabetes sabemos que la educación es un elemento infaltable para toda acción que se proponga para hacer frente a los rezagos en la atención a la condición. Búsquenos en México para aprender con nosotros. Agradezco la oportunidad que le brindan a la Federación Mexicana de Diabetes, Asociación Civil, en dirigirme a ustedes. Soy Fernando Alcántara, presidente de la Federación Mexicana de Diabetes y vivo con diabetes tipo 2. Gracias.
Many people with diabetes suffer due to lack of education, medications, and continuing care. Insulin enables a person to use energy effectively in order to survive and maintain well-being. After 100 years since its discovery, many people still do not have easy access to this life-saving medication and the supporting system needed to ensure its safe and effective use. Most people with type 1 diabetes are young and need insulin to survive and stay productive, while many people with type 2 diabetes need insulin along with other medications to control blood glucose and prevent acute and long-term complications. In 2020, 44 experts from 5 continents published the Lancet Commission report on diabetes, which provides a roadmap for reducing the global burden of diabetes and the consequences of no action versus actions. In 2017, 15,000 young people with type 1 diabetes died. Over 80% of these deaths could have been prevented if they were given insulin along with comprehensive care and education. Over 200 million people with diabetes live in the developing world, and 3.2 million might die in the next 3 years, mainly due to heart disease and stroke. Using diabetes team to gather data systematically for empowering self-management and ensuring early use of medications to reduce multiple risk factors, 800,000 deaths can be avoided. To achieve this, concerted actions from the government and community is urgently needed to transform diabetes prevention and care, which will save millions of lives and billions of dollars.
Diabetes is both a disease and an indication that people are at high risk for other diseases, particularly cardiovascular disease. Cardiovascular disease is the leading cause of death among people with diabetes, and yet it can be prevented. Controlling blood pressure is critical to preventing early death for people living with diabetes. Fortunately, for both diabetes and hypertension, it is possible to diagnose and treat through strong primary healthcare systems. Resolve works with partners in countries that provide simple, patient-friendly care to more than 1 million patients with hypertension. Success is based on 5 components. First, treatment based on a simple protocol. Second, a consistent supply of medications and supplies. Third, team-based care. Fourth, patient-friendly services. And fifth, an information system that facilitates patient and program monitoring and quality improvement. Examples of successful practices include nurse-initiated and managed hypertension treatment that makes care both more accessible and more efficient, and drug refills for 2, 3, or 6 months for patients with stable blood pressure. Success also requires financial and political commitment. We need to maximize efficiencies, leverage markets, and increase transparency to bring prices down and improve the quality of drugs and diagnostics. Hypertension and diabetes can also be prevented through interventions that change the food environment. These include front-of-package labeling and public food procurement policies. We can prevent and effectively treat diabetes and hypertension, and we must, because millions of lives are at stake. Thank you.
Dr. Carissa Etienne is the director of the Pan American Health Organization. She's going to be talking about diabetes in the Americas. And as you're about to hear, she's personally invested in that topic.
Excellencies, distinguished guests, colleagues, I am pleased to join the Global Diabetes Compact and to pledge my commitment to improve diabetes care in the Americas. I have lived with diabetes for 33 years, so I am one of the 62 million people with diabetes in the Americas. I know firsthand the challenges of managing the disease, especially during the COVID-19 pandemic. Among the most concerning aspects of this pandemic is the impact on people with diabetes and other NCDs. Although the exact toll is yet to be fully understood, we are very concerned about the consequences of adverse lifestyle changes, the interruptions in healthcare services, and the supply chain disruptions, which limits the access to medication. This is especially true for insulin, which even prior to the pandemic was not accessible to millions of diabetics. This impact has perhaps been greatest in people living in vulnerable circumstances, such as indigenous people and populations of color, who have higher rates of diabetes and are dying from COVID at higher rates. Throughout our response to the pandemic, I have highlighted the interconnections between COVID-19, chronic diseases, and diabetes, calling for urgent action to maintain essential services. The Global Diabetes Compact will help ensure this focus is realized. Thank you for your attention.
Thank you, Dr. Etienne. With more than 420 million people around the world having either type 1 diabetes or type 2 diabetes, it is a global epidemic. So what happens during a global pandemic with the global epidemic of diabetes? We are joined by Dr. David Nabarro. He's the WHO Special Envoy for COVID-19. Hello, David.
Colleagues and friends from the World Health Organization, from the University of Toronto, and from elsewhere all over the world, thank you for your invitation to participate in the launch of the World Health Organization's Global Diabetes Compact. Disparities in access to healthcare have been known about for a long time, and I've been focused on them in my role as a public health physician for decades. But let's just think about what we really mean. If people don't access healthcare, that leads to imbalances in population health. If they don't have access to healthcare, it can lead to catastrophic expenditure on trying to get cure for sickness. It can lead to real impact on long-term ability to thrive, especially when people are experiencing chronic conditions. And it's become really pronounced over the last year as we've seen resources diverted to manage the COVID pandemic. And whilst this is appropriate in the short term, in the long term, it's not sustainable. And the consequences of the diversion of resources is leading to increasing incidence in treatable, non-communicable and chronic conditions, of which diabetes is right in the center. Let's build resilient health systems out of the consequences of COVID and make sure that we move forward to a better situation altogether. Some people talk about building back better from COVID. I talk about moving forward fast and fairly, because that's what we've got to do, is to move to a better state informed by COVID and take advantage of what we are learning as we do it. Thank you for all you're doing, and let's keep moving forward on health equity for all everywhere.
The Global Diabetes Compact is a World Health Organization-led initiative which will unite stakeholders around a common agenda to reduce the risk of diabetes and ensure that all people diagnosed with diabetes have access to affordable, comprehensive quality management.
When HIV/AIDS started, the cost of treatment of one patient per month was approximately $2,500 US. Pre-qualification came in and was able to identify quality-assured antiretroviral medicines. The cost of treatment has dropped now to less than $50. We want to believe we can extrapolate this learning to the area of diabetes and particularly the area of insulin.
Healthy diet helps keeping energy balance, having adequate complex carbohydrate, fruit and vegetables, legumes in the diet is so important for keeping the glycemic control.
Currently, 1 in 4 adults are not meeting the recommended levels of physical activity, and the levels of physical inactivity in adolescents are even higher, and they'll be the adults who are at greater risk of diabetes. We also know, very worryingly, that those people living with diabetes are more likely to be less active. So we've got a large job to do to promote physical activity, to prevent and to support those people living with diabetes.
Design and conceptualization of the compact, we've inserted this attention to lived experience, in particular with lived experience of diabetes. The HIV community, they have repeatedly stated that when they finally unpackaged what meaningful engagement of people living with HIV was and how that could support and structure their policies and programs, it was a pivotal moment. It was a game changer in sort of the attention to the disease, attention to the access, affordability, availability issues, and attention to the needs of people living with the disease.
We might look at the dimension of nutrition and food policies. Some colleagues would look at healthcare and access to essential drugs and technologies for diabetes. We might look at the burden disease in terms of surveillance, the prevalence of diabetes in our country. So all those functions require a lot of coordination and contribution and alignment all together. And I think this is the spirit of the compact, is to bring all those elements and stream of work together, whether at a global level, at a regional level, or at a country level.
The compact is really important because it is a huge global challenge, the increasing burden of diabetes and the increasing rate of premature mortality.
The compact offers an opportunity for us to all work together to put together the solutions we know can be effective.
Because our common target is to have the satisfaction of the beneficiary, and we want to have that person treated.
I get excited, the same excitement I saw when that revolution came to HIV patients. I am excited that this revolution is coming to the diabetic patients.
It's going to take an international village to make the Global Diabetes Compact happen. These next speakers are leading the way.
IFPMA is pleased to join the Global Diabetes Compact. 14-year-old Leonard Thompson was the first person with diabetes to be treated with insulin in 1922. Let us today honor the bravery of Leonard and millions of others who lived and are living with diabetes across the world. Over the decades, our industry's innovation has significantly improved management of diabetes. Treating diabetes today is like day and night compared to the past. We bring solutions across medical education, prevention, treatment, and care. Inequities remain in terms of access to comprehensive diabetes care, of which insulin is just one part. Together, we need to do more to ensure access to treatment for everyone in the global diabetes community. We, IFPMA, commend the Compact for its vision. We are committed to playing our part in partnership with other sectors. We are committed to exploring new and collaborative models for improving prevention, diagnosis, and access to quality diabetes care. This includes scaling up existing initiatives, developing new ones, and assessing sustainable business models for low-resource settings. If countries invest more in healthy populations and resilient health systems for NCDs as part of UHC, our collective efforts have the potential to be transformational for people living with diabetes.
Greetings from Australia. I'm delighted to pledge Life for a Child support for the Global Diabetes Compact. Of all people with diabetes, children and youth are often the most vulnerable. Most have type 1 diabetes and, of course, need insulin for their very survival. They walk a tightrope every day between dangerous blood glucose extremes at the very time they are growing, exploring, being educated, building relationships and working to become independent. In many, many countries, they have inadequate access to insulin, blood glucose testing, skilled healthcare, and even the most rudimentary of diabetes education. And until recently, in some countries, there were almost no adults alive with type 1 diabetes. While addressing the entire need is not impossible given sufficient resources, Life for a Child estimates that there are approximately 360,000 young people living with type 1 diabetes in real need of help and support right now. So in concert with the centenary, we have launched an ambitious plan to expand our support from the 23,000 people we support today to 150,000 young people by the year 2030. And also key to our efforts are the local champions in each country, health professionals, and in many instances, the people living with diabetes themselves, with the local expertise, the lived experience, and the dedication that's so critical to the positive outcomes that we see. Dr. Graham Ogle, Emma Clapman, and the rest of our small and remarkable team will continue to support these efforts in less resourced countries, continue their extensive research around access, epidemiology, and clinical outcomes, and continue their advocacy efforts to improve the level of care and foster sustainability. No child should die of diabetes.
Today, millions of people worldwide cannot access diabetes care. This is especially the case in many low and middle income countries. For the past 20 years, the World Diabetes Foundation has worked to change this. We build partnership with low and middle income countries worldwide to improve diabetes care and prevention. But the many efforts currently underway are not enough. Much more must be done urgently to stop the rise of diabetes and its devastating effect. The World Health Organization Global Diabetes Compact, which is launched today, is exactly what the world needs to accelerate and scale up the global response to diabetes. The World Diabetes Foundation will support the new Global Diabetes Compact in many ways. We will mobilize more investments from foundation and the private sector. We will expand our engagement with the global community across regions, sectors, and advocate for new partnerships with governments and civil society. And we will launch a new initiative to put digital resources in the hands of healthcare workers in low and middle income countries. 100 years ago, the discovery of insulin transformed diabetes treatment. Today, technology is driving change in healthcare. With our new digital health initiative, we will leverage technology to help healthcare workers deliver the right diabetes care at the right time. It is part of our commitment to ensure that all people with diabetes have access to care and treatment in alignment with the Global Diabetes Compact. We deeply appreciate this landmark initiative. The world has been waiting for this moment.
The International Generic and Biosimilar Medicines Association and its member association are playing a crucial part in worldwide patients' access to high quality and affordable diabetes treatment, including insulin. Around 6% of population around the world are living with diabetes worldwide, 4 times higher than what it was in 1918. This number is expected to increase even more. In this context, the generic medicines industry role is critical, and it contributes significantly to many diabetes medications in the world, like metformin and gliclazide. However, the patient in all countries need to be treated, and many will also require insulin at an affordable price. Our mission at IGBA is to continue to make patient access to diabetes treatment, including insulins. We are continuously working to identify systemic barriers to patient access, be it by proposing new approaches for greater regulatory efficiency or shaping market mechanism policies that can lead to improved access. As a global organization, we are also reaching out to all stakeholders, our generic and biosimilar medicine associations, who can join our common cause to support worldwide access. Joining forces with all stakeholders comprising of public sector, private sector, and people is important. It is the only way to ensure that every patient in every country can get the medicine they need and deserve. Thank you.
Your Excellencies, ladies and gentlemen, even before the pandemic, diabetes had entered the top 10 major causes of death worldwide, increasing by 70% since 2000. The NCD community faces major barriers to access to diagnosis and care for diabetes, leading to severe comorbidities. Around the world, a person living with diabetes undergoes an amputation every 30 seconds. 1 in 3 people with diabetes live with preventable blindness or vision impairment due to diabetic retinopathy. This is a preventable, slow-motion catastrophe, and it has been allowed to happen by policy inaction on diabetes prevention and essential care. For that, we must hold governments accountable, and we call for urgent change. We applaud WHO for the compact. This is just a first step, however, and must be followed up urgently with impactful policy decisions by governments. We call on WHO to propose ambitious targets and deadlines. No child should die of diabetes. Everyone should be able to be diagnosed and access the treatment they need at a price which doesn't break the bank for people or for governments. A clear investment case for action on diabetes and its comorbidities is needed, including mental health, to support this vision. NCD Alliance commits as an advocate for policy change and investment and to ensuring voices of people living with diabetes are heard in the Compact's monitoring and governance. We're an active member of the Coalition for Access to NCD Medicines and Products, which has a focus on access to insulin and essential supplies for diabetes care. To anyone who thinks NCD should take a back seat to the pandemic, a reminder that diabetes is among the top 3 underlying conditions for people who have died of COVID-19. This is not an either-or decision. We must act on NCDs, including diabetes, as part of pandemic recovery and for our future health security. We thank you.
This is a time of great historic significance for the global diabetes community. Regretfully, it is also a time for great concern. We have seen how healthcare resources have been stretched as health systems across the world struggle to tackle the COVID pandemic. And of course, we have seen people with diabetes severely impacted by COVID. As the world looks to build back better, sufficient focus and funding must be directed towards improving diabetes care, preventing diabetes and its life-threatening complications, and addressing the huge disparities in standards of care that exist globally. IDF welcomes, therefore, WHO's increased focus on diabetes at this time, and of course the launch of the Global Diabetes Compact. We see this as an opportunity to address the need for a sustained collaborative effort from all diabetes stakeholders. We welcome WHO's efforts to involve people living with diabetes in the compact preparations, and we look forward to seeing the diabetes community actively involved in the development and implementation of compact initiative. We have a broad network of more than 250 member associations and in 168 countries and territories, including many low and middle income countries. We pledge our support through our advocacy and our awareness activities. We will help to build capacity and improve standards of care. We will support the compact towards the prevention of type 2 diabetes. And we will bring our global expertise to support the compact generally. This is a historic time. We have a chance to rewrite the chapters of the history of diabetes. For the close to 500 million of those estimated to be living with diabetes across the world, and many more at risk. This is a unique opportunity. Let us not waste it. We need to take action on diabetes now, perhaps now more than ever. And if not now, when?
If not now, when? That is the challenge from Professor Bolton. The answer is now, because you are right here in the Global Diabetes Summit. The WHO's Global Diabetes Compact is led by Dr. Bente Mikkelsen. She joins us right now. Dr. Mikkelsen, great to have you.
Thank you so much, Femi. This has been a fabulous day so far, and thank you for all using time, and especially a warm thank you to the heads of state and governments, Ministry of Health, people living with diabetes, academicians, partners. You have heard today about tireless efforts to improve prevention and treatment for diabetes. Yet, as we know, the number of people with diabetes is going up, and access to affordable treatment is not a reality for many in need. What's more, diabetes prevalence have been rising more rapidly in low and lower middle income countries. These are, as we know, countries least well equipped with diagnostics, medicines, and knowledge to provide life-saving treatments for diabetes. We have also heard today how the COVID-19 pandemic has brought additional pain to people. Many people who require regular care and treatment for their diabetes have struggled to access that care. And people with diabetes are at increased risk for severe disease and deaths from COVID-19. But the lack of access to affordable insulin and diabetes care is not a new phenomenon. This is despite the fact that insulin was discovered 100 years ago. And again, thank you to the University of Toronto and the Government of Canada. We know that 5-year-old Teddy Ryder was one of the first people to receive insulin in 1922. He was an American who had traveled with his mother by train from New York to Toronto, and it was rewarding. He would go on to live 71 years more with diabetes, one of millions of lives saved and made better by insulin. Bringing diabetes care to all who need it is a moral imperative. That's why today we launched the Global Diabetes Compact, a new initiative that will bring structure and coherence to our efforts to reduce the burden of diabetes and improve access to affordable treatment. The pandemic recovery is actually our chance. The 100 years after discovery of insulin is our window of opportunity. 2021 must be the year that we get on track. So you might wonder what will happen next. So the Compact will continue to engage people living with diabetes to co-create solutions. We will also provide coverage targets. This is important to be able to track and trace progress, which is important for people living with diabetes, for the care of people living with diabetes, and also for the policymakers. We will be able to provide more quality data for diabetes, which is important for the same reasons. And of course, I will mention the biggest priority is, of course, to identify pathways in the poorest countries first, to be able to provide better care, both when it comes to essential diabetes technology, medicines and health systems, and also education and health care providers. Let us continue to work together to make sure that through this ambitious and much needed collaboration, we will soon be talking about a decline in diabetes as a public health problem. Let us strive together to use the opportunity to restore after a horrible pandemic and include diabetes into universal health coverage to be better prepared for another pandemic, but more importantly, to have more people like Terry Ryder achieving getting care to achieve a long life with a lot of prosperity. Thank you so much for using time with us today, and I look forward to work together.
So by now, you know all about the WHO's Global Diabetes Compact. It is an idea. It is not fully formed yet. How do we turn it from this idea, this plan, into concrete action? To talk about next steps, I'm joined by Dr. Apoorva Gumbar. She has such an impressive title. I'm going to get her to impress you with her very long title. Dr. Apoorva, it's so good to see you. Welcome to the Global Diabetes Summit. Tell us what you do. What's your official title?
Hi, I'm happy to be here and thank you for having me. So I'm actually Dr. Apoorva Gumbar and I'm originally from India. But right now I'm logging in from Boston because I'm studying at the Harvard T.H. Chan School of Public Health. I'm doing my master's in public health here. And professionally, I'm actually trained as a pathologist and I've been working in the diabetes community for people living with type 1 diabetes through advocacy initiatives and also as a young leader in diabetes at the International Diabetes Federation.
So Dr. Apoorva, we've had a summit where we have talked about the importance of prevention of diabetes, the access to care, how equitable it needs to be around the entire world. So this is the idea of the Global Diabetes Compact. But then what I'm wondering is about next steps. What do we need to do? Not talk, action.
I feel the Global Diabetes Compact was one such platform where the lived experiences of people was considered as one of the crucial stakeholders on the table. So now where do we go from here? So I feel there are three key takeaways which I feel are very essential, that we've done the talking and now we have to just bring it to action. So the three takeaways are the important step that we need to ensure there is a more inclusive care in the management of diabetes globally. So first would be adding value and emphasis to people lived experiences and actually identifying them as key stakeholders. We've heard them. There are challenges across the globe from people like living with type 1 diabetes or type 2 diabetes, and they have been very unique. So from here, we need to amalgamate a diverse model into the diabetes care model. Second would be focusing on research and overcoming the inequities in diabetes care. There are so many people, even after 100 years of the discovery of of insulin, they still do not have access to insulin or diabetes supply. So I think we need to look forward for better insurance modeling, better innovative payment models, so that access to insulin isn't hampered. No, every person deserves the right to have access to basic resources for taking his or her care. So I think that's one of the essential key takeaways. And third would be basically to create momentum around chronic diseases. Like, it's not just about a person has diabetes and he's going to do it himself. It's about thriving with type 1 diabetes. So I think mental health should be integrated into the care model because it's a chronic condition and a person has to be motivated to take intervention when it comes to management. So I think we need to handhold the person living with diabetes, handhold and give him that courage to walk ahead forward through Global Diabetes Compact. It's just baby steps, but we're going to get there.
Dr. Apoorva Gumbar, thank you so much. Appreciate you.
Thank you so much for having me.
We have heard about the challenges. We have heard many commitments and plenty of solutions. The only thing missing from our Global Diabetes Summit is the action. So let's get to work. Thank you for being part of the summit. Thank you for watching.